Okay.
And we actually sent Leslie to see Dr. Kevin Satigue at LSU Health Shreveport Hospital for a much-needed medical checkup. Let's have a look at what happened.
The last time I had a physical, I couldn't tell you, maybe 10 years.
It's important to get a basic physical exam every year because physicians can detect things in their earlier stages.
I'm a little scared because the fear of them telling me I'm pre-diabetic or I'm diabetic. Heart disease, that scares me.
What I'm going to be looking for first is any early signs of arthritic problems. As far as her height and her weight, that would put her in a moderate to increased risk category.
He went through from my lungs, my heartbeat, he did my blood pressure, checked for edema, checked even in my feet for my pulse.
Just looking at your blood vessels in the back of your eye.
The back of her eye is actually the first thing that we can actually detect some early blood vessel disease processes, particularly in diabetics or hypertensives.
They just drew blood and they're going to test my cholesterol.
Just hold pressure for a few minutes before I put your Band-Aid on.
We're doing an EKG so that we have a baseline to compare it to in the event that there were an abnormality later.
If something serious were found today, I'm a little scared.
Welcome back to The Doctors. We're here with Leslie, who has finally decided to face the biggest health threat of her life, her weight. We recently sent Leslie to Dr. Kevin Satigue, the Chief Medical Officer at LSU Health Shreveport Hospital, so he could evaluate her with a full medical checkup. It had been over 10 years since she had had one, and Dr. Satigue is on the phone with us. Dr. Satigue, how was Leslie's appointment and what did you find?
Leslie's appointment was outstanding. I'm happy to report to Leslie and you in the audience that basically all of her years of being an athlete and taking care of herself allowed her the opportunity to bank some positive things there, and it's not too late for her to get herself back to that competitive swimming person that she wants to be.
Now, I see this as a second chance, and as a mom and a doctor, you know, it's so easy, and we have all done it with the kids and the fast foods as much as this little one will jump on top of your back, because I know it's more speedy than the less expensive factor to it. But you know, your life isn't over, and sometimes it is birthdays. I hear with my patients a lot, and we as women, that 40 goes off, and sometimes that is the impetus to get you to move in the right way, to be there for your daughter, to take that second chance, to go after your life. Because as mothers, we so much put our family first and not ourselves.
And Dr. Satigue, I just want to quickly thank you so much for taking such good care of Leslie. And you probably can't see her face right now, but you put a massive smile on her face with those results. So thank you so very much.
Thank you for the opportunity, and good luck, Leslie.